Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? When was their last meal? They think they can fool their PET scan. End up losing money, time and over irradiated. I'm vet student. Many clients like to say I don't overfeed my dog cat. That's just their normal size. When their pet looks like a watermelon. Had a patient refuse to admit he swallowed a pen, even though an x-ray showed the pen in his small bowel and we took the pen out during an emergency surgery. I can literally smell the smoke on your clothes and breath. See the nicotine stains on your fingers. And you're trying to tell me you quit smoking 10 years ago? Not a doctor, yet, but was volunteering in the emerg ward and a woman came in with her pregnant daughter. Not only did she refuse to believe her daughter was pregnant, but was feeding her laxatives to deal with the extra weight. It was pretty horrible stuff. Once had a woman come in for a possible yeast infection. On exam she had a glass bottle stuck in her veal filled with urine. Totally wouldn't admit it was hers or explain how it got there even after we removed it. Just kept saying I think this is all a joke and you put it up there. There was a woman sent in by her family doctor for urinating some blood. We put a camera into her bladder with her awake, looking to exclude a tumor. We found her bladder full of citrus seeds pits. So many of them. When asked why she put them there she said oh so well I eat a lot of fruit and wouldn't accept any responsibility for them being there. How the remote control to a Zenith television wound up in the rectum of a 54-year-old father of two. They stopped making Zenith television sets years ago. From a medical perspective, why do you still own this remote? That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. Only work records in a clinic, but we had a woman come in with a report of veal odor. All well and good. It happens all the time in an obgyn clinic. What she hadn't bothered to say was that she'd gotten a tampon stuck around the end of her last period. She'd gone through menopause 7 years prior. Not a doctor, but a nurse. When you come into the hospital wanting to detox, and I ask you how much you drink, please stop lying to me. Withdrawal from alcohol is nasty but I can make it a little more bearable. If it's 2 bottles of vodka a day, tell me so I can medicate you accordingly. You'll thank me later when you aren't having a seizure. This one is sad. From my old roommate. Girl had a very large lump on her breast that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When they found the lump, they asked why she didn't say she had that. She said she knew it was going to kill her eventually, but she just wanted to get rid of the migraines because they giving her a lot of pain in her last months. Not a doctor but my husband. He had a 17-year-old girl with abdominal pains come into the ER with her mum. Turns out she's in full-blown labor. Assures them she can't be pregnant. She's a virgin. The baby is literally crowning right there in ER. No maternity ward in their hospital and she was in advanced labor when she arrived. And she still insists she's a virgin. Edit. Poor wording. My husband was the doctor, not the 17-year-old girl. I'm a pediatric dentist. So maybe not the type of doctor you were looking for, but this one throws me for a loop every time so I'll share it. When I sedate kids they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them it's very important because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites. But one kid walked in eating a bag of Cheetos at reception and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. Nurse here had a patient accuse me of eating in her bed and threatened to sue me for malpractice. Keynote, she never got out of her bed. All the symptoms of pregnancy plus 2 positive pregnancy tests. There's 0% chance I can be pregnant. I'm not married. To be fair, the patient's mother was there and this was in a very conservative country. She ended up admitting she was pregnant when we separated her from the mom. Other than all the random things that end up in rectums accidentally, Drunk electrician with the longest drill bit I've ever seen sticking through both legs and impaling his scrotum in between like a really gross kebab. He was so drunk he thought he broke his hip. Denied owning any drill bits or for that matter having been drinking. Most common are the numerous drug tox screens we do that come back positive for something and everyone is shocked. Borderline offended it got into their system. I admitted a guy for chest pain. As part of the workup, I did the urine drug screen which came back positive for sugar. After the rest of his cardiac workup was negative, I said to him, "Good news, you didn't have a heart attack. It's likely that your chest pain was caused by sugar." His answer, "I didn't use sugar. See, I was at a party and people had some lines of sugar out on a table. As I was walking by, an oscillating fan blew the sugar into my face, which is why my urine was positive. MMMHMM. Got it." Had a patient in hospital. I forget what for. The point is that he disappeared for a few hours. When he came back he was tachycardic to 160 BPM. Massive pupils. Couldn't sit still. We asked him what he'd taken while he was out. Nothing. He swears. He went to the pub and just drank lemonade. Okay, we say, "We're gonna take some blood and find out what you've taken." He then pipes up the friends he was with would think it was funny to spike his drink. What? We asked. Did he think they might have spiked his drink with speed? He says, "What do you know?" Blood confirmed that he had taken speed, but he insists he didn't take it. His drink was spiked. Not a DR, but worked in a hospital for a long time. Had a PT come in that had OD on heroin. Was able to get him set on that front. However, he had necrotizing fasciitis in his pectoral from injecting there. He was septic and honestly a bit of an asshole. He kept trying to tell us the reason he was there was because of a motorcycle accident. We all knew, but he was in absolute denial. He eventually heals up and transfers out. After a couple months, he came back about 6 months later to say thank you to all of us and to apologize for all the lies and assholish behavior. Seems it was enough to get him out of that life and onto a new one. I think about him now and then and hope he stayed clean. I'm a nurse, not a doctor, but it's amazing how many patients lie about how much they drink. Dude, we aren't judging you. We just want to know if we need to worry about you detoxing when you come out of open heart or any other surgery. Eater, a lot of comments in here seem to be about your personal doctor visits. My comment was very specifically referring to major surgery. All I am saying is this: if you're going to land in the hospital for a significant amount of time and you're an alcoholic, it is to your benefit and safety to be honest about that, because the odds that you will withdraw in your time there is high. If providers know, they can plan to manage that so you don't withdraw. Last, sounds like a lot of you have run into itty, judgy people in healthcare. We aren't all like that, and even the judgy ones really don't want you to detox on their shift. How a 20-ounce glass Coke bottle was lodged all the way up a guy's rectum. He denied it vehemently in front of his wife. That was weird and awkward. Not a doctor but a nurse. Had a patient come in with a toothpick in his D. Refused to tell me how it got in there, insisting he was picking his teeth and it fell in. Being pregnant and also a virgin. People actually believe women can get inseminated in a public pool or after their parents had sex in the jacuzzi and the girl uses the jacuzzi and is inseminated by the father. One of my lecturers told us a story of when he worked in ED. There was a man who refused to acknowledge or tell them how a jug got stuck in his rectum. They were taking him to the OR as it has created a vacuum seal and couldn't be removed without shattering, but realized his BSL, blood sugar level, was off the charts. Really high. They were considering postponing the surgery to work out WTF was going on. When he ended up talking, he told them the jar was full of honey before it got lodged and was rapidly absorbed by the rectum, causing the insane levels. What? I am a doctor. Not a single random thing up my ass is weird to me anymore. I've heard or seen it all. Nor is it that surprising when somebody is wacko enough to claim they got Lyme disease sexually from their husband, who got it vertically from his mother, and that's why they are sterile. If you aren't aware, this is bonkers. The actual weirdest thing for me was that one time when a severely obese person just refused to admit they ate anything but one small salad a day. It just comes down to math. You cannot get up to 500 pounds unless you put 500 pounds of stuff into you at a decent pace. Plus we found a snack wrapper in the inaccessible folds of your palace. Jeebus. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup and pointed him to the bathroom. I went to check on my other patients and came back. Kid was still in the bathroom. I go knock on the door. Hey buddy, you okay in there? Sink on full blast. Yep, everything's fine. I go back to his room a few minutes later and he hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. Hey buddy, are you sure this is urine in this cup? Yay. My pee is always clear. PT is wheeled off the x-ray. I check the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on little homie. You gotta do better than that. Patients lie about the most mundane things. They will tell you they don't smoke cigarettes when you can smell it all over them. You can see a pack in their purse. And you physically saw them smoking outside before they came in for their appointment. That's not what annoys me though. What annoys me most is that patients will Google what they think is their diagnosis. Admit they did. Get their diagnosis right. Then argue with you about the recommended treatment and deny having read that also. The classic example is bronchitis. Patients will Google it, read the Wikipedia article, then still come in and demand antibiotics. When you confront them with this they will pretend they didn't know that they read that antibiotics do not work. They do this with almost any disease in which the treatment is conservative management and yet they will still come in asking for treatment that has no evidence. If you're going to become an internet expert, don't do it 50% and deny you didn't read the part about treatment. Edit. Roughly 80% of what comes into urgent cares can be managed at home with do nothing. Rest. Drink fluids. Take Tylenol. Having sex. They were pregnant. Obligatory, not a doctor, but it would probably be eating bugs. You weren't breathing. We gave you Narcan. You started breathing again. Woke up. And then deny you used a narcotic. Yeah, right. Kind of the opposite situation. But I had to go to the ER because I couldn't keep anything down and I was dehydrated. Doctor asks if it's possible that I'm pregnant and I said I am sexually active. But I just finished my period. So it was unlikely. She just stared at me for a second and starting laughing. Apparently no one ever just admits they have a sex and always tried to hide it. For some reason. Turns out I had a kidney infection anyways lol. Maybe not so weird because the person was whacked out of their mind. But once had a patient who was clearly on drugs and vehemently denying it. I'm not a doc, but I'm a lab tech and draw blood in the ED regularly. While I was drawing their blood the patient was screaming at me to stop letting the green men that were coming out of my arm touch them. Turns out, they were tripping balls, but underage and refused to tell us anything for fear of their parents finding out. So in my story, I'm actually the patient not telling the doctor something, but I felt like it was good edort and relevant enough to share. But when I was like 13 or so I ended up with a urinary tract infection. Which was odd because I'm a guy. I ended up having to go to the children's hospital and had to go through all this stuff to try and look at it and fix it and whatever doctors do for a UT. What I didn't tell them, and still haven't told anyone except my wife, was that this happened because I was curious what it would feel like to shoot water up my dong with a hotel shampoo bottle. Not great. But if you pump air up there it makes a mini fart sound when it comes out, so I guess that's a plus. Med student. Went to see a patient for my practice physical. These are all volunteers and we don't get charts or anything, just a slip of paper with their name and chief complaint. I walk into the room and this elder gentleman is holding his cup of coffee and didn't shake my hand, which threw me off guard. Then I noticed one of his hands was much weaker and kind of scrunched up and he didn't move it. So I asked him about it and he was like, "Nah, it's fine. See?" And proceeded to move it like a 1/2 inch. It clearly was not fine. I'm sweating now cause these are mainly just opportunities to talk with patients and there's supposed to be a breeze, but this guy looks like he had a stroke and had no idea. Turns out he was just messing with me. But I was ready to call in a real doctor cause I was freaking the duck out. Edit. The dude really did have a stroke. It was 15 years ago and only affected his one arm, he just liked to pretend it was fine. Once he made that clear, the rest of the history physical was great. A friend's mom wouldn't admit my friend had scoliosis. Does that count? I had a patient who came with his boyfriend. He had severe abdominal pain. He claimed it started when he had a difficult poo. Tests showed he'd ruptured his colon and it turned out it had happened using toys during sex. To me it's weird because he'd introduced me to his boyfriend, so it's not like he needed to hide his sexuality. That they can't afford their meds? Yep, America. It's so weird. We can for sure tell you when taking them. It's put your life in serious danger, and if you don't fess up it could kick you off the transplant list for non-compliance. It's such a taboo, I guess, to say you're poor. You had to pick lights or meds, food or meds, gas or meds. It sounds so simple, doc, I just couldn't afford that and food, but it takes some work sometimes to get people to just tell us. Obligatory, not a doctor. I'm a nurse. We had a patient come into the operating room for brain surgery. Probably a mid-50s guy with a nice head of light brown hair. Before a patient comes into the actual OR, we ask them a series of questions, including whether they have any implants, jewelry, non-hospital clothes on, etc. Guy says no to all the questions. After the patient gets put to sleep, the surgeon grabbed his hair to start shaving it off, because you know, brain surgery, and all his hair peeled off because he was wearing a wig and didn't tell us. We almost shaved his hairpiece because he wouldn't admit to anyone he wore it. Not a doctor but work in an ER. One day some pretty young parents brought their toddler in because he was super lethargic and not responding to any stimuli, and the parents said they had no idea why. The staff were pretty concerned for him because those symptoms are a pretty big red flag for small kids. So we start running a bunch of tests, including a drug screen which ended up being positive for THC. The doc goes and talks to the parents about it, and they finally broke down and admitted that the kid had eaten an entire bottle of their weed gummies while they weren't paying attention a few hours earlier and was just high as it, lol. My patient presented over several months with recurrent huge abscesses that we couldn't explain. She was in horrible pain. Had to stop working. We tested for everything. Eventually her husband called me that he found syringes in her medicine cabinet. I think she was injecting herself with fecal matter. When the syringes were found, she stopped coming to her appointments. To those asking why, I think she has Munchausen syndrome. She wanted the attention from being sick. I started getting suspicious when she always would get a new abscess before any court dates, CPS problems, and need a doctor's note to get out of it. She denies everything, and it's very hard to have someone committed unless they are acutely suicidal. I have told this story before on Reddit, but not for a while. A story that resides at the nexus of oncology and psychiatry. Middle-aged man enter ER in sweatpants. Worked as an accountant but currently unemployed. He tells me that a urologist had diagnosed him with inflammation of his epididymis 3 years earlier, but he hadn't followed through on the treatment, and that he now wanted to get things taken care of. During the physical exam, I see a grapefruit-sized mass in his scrotum. It was not subtle in any way. I call in urology and order a CT scan. I tell the guy that this isn't inflammation. It is a tumor and we need to do more tests to find out what type of tumor. He stops me and tells me he didn't understand what I had said. Could I please repeat it? Then he pulls out a pad of paper and writes down my exact words and sits there staring at the words for a few minutes. I just felt really sorry for the guy. How they really got a spider bite on their tongue. That they had maggots in their foot wound. Patient with diabetes came in to see me in clinic. Said foot had a wound. I asked when they last looked at it. They said that morning, and this was an 11 AM appointment. Helped them take off their sock. There were 4 maggots busily cleaning a pretty large ulcer on the side of the foot. I threw up a little in my mouth and proceeded to remove the maggots and dress the wound. A damn clean wound due to those maggots.